Hi, I'm Dr. Fred DiDomenico from Elite Coaching, and I want to give you another tip that's really important. How important? Really important. In fact, your patients' lives depend on this tip. Okay, now we spend weekends, hours and hours and hours and hours, really showing you how to do this. Here's the tip. Are you ready? 80% of influence is psychology and physiology. Physiology, 20% is facts. So what is a chiropractic? What's that mean? What's chiropractic profession taught us? They taught us how to describe a subluxation, how to describe the principle. But you ever notice with a patient, some people, you show them their x-rays, you talk to them about the principle, you show them their spine subluxated, you talk about subluxation, shutting down energy of the body, and they're so objective. It's like, when they're done, doc, what's my insurance cover? Can you just crack my back? And you just want to choke them and go, were you listening? You know what I mean? That other people are completely engaged and they get it. Why does one person get it and another person never shifts their focus? Well, it's not their fault. It's our fault, right? Put your finger on your chest, say it's my fault. Why? Because we didn't know how to influence them. But when you look at 80% influence is psychology and physiology. It's physiology. You have to change the way they feel to change their psychology, and then they justify with fact. Okay, so why is that? Because here's how this really works. Whatever a person focuses on, they're going to assign a meaning, right? What's that difference between the person that gets it and the person that doc cracked my back? Well, their meaning is different. What's that person that's objective and the other person that's fully engaged? They assign a different meaning. The problem is that's a huge variable, right? And their life is dependent on that variable. So if we can control that variable, and we have influence, we can help them determine what it means, and it changes the way they feel, changes their physiology, now it changes the way they think. This is how people work. Okay, so we're gonna go through 4 steps. How many steps? 4 steps. We're gonna go through that in a minute. So that's a variable that we need to control. So you take what they're focusing on, then you gotta find out what meaning do they assign. When that meaning has an emotion, it determines the way they feel. It shifts their physiology, that determines their state. So we have to know what they're focusing on by what they say. Our focus never comes off their condition. So when they say, what's my insurance cover? Their focus is on the money. Well, how much is it, doc? What's my copay, right? Focus is on the money. Doc, just cracked my back. Focus on back pain, it's not on the bigger picture. Okay? So by questions, we can change their focus, help them establish their own meaning that change their physiology. So here's how we do it. This is all on day 1. This is a whole 2.5-day boot camp. Actually, it's 2 boot camps, but we're gonna give you 4 tips from the first boot camp. Each one we spend 4 hours on. All right, so we're gonna give you the 10 words or less version. Number 1, step 1 in the pre-consult, you gotta get them from pain into posture. What's that mean? Hey, here's how the normal body works. Let's at least know that the energy from the spinal cord goes to all the organs, and when your spine is subluxated, it shuts down that energy. Let's use an analogy like a dimmer switch. All right, turns down that energy and you bring them into agreement that their body can cause disease, right? Not only, and in the pre-consult in 3.5 minutes, we say, hey, you know what? You're having back pain. That means the nerves are inflamed, but really your whole spine is weak. So can you see, Mrs. Jones, how your posture not only weaken posture and your whole spine weakness, not only causes back pain, but affects your overall health. When they get to that agreement, then great. Now that's 20% facts. So let's get a common reality. Now we move into the consultation. We don't do OPQRST on their pain because the paperwork does that. We have a patient application form that already takes care of that. So what do we focus on? We direct their focus. Who directs their focus? You do. So we focus on the organs, Miss Jones, the nerves and low backs, and the strength and energy into your hips and legs, or in your pelvic organs. Postural weakness down there in your low back can weaken. Your reproductive organs, menstrual cramps, irregularity. So you go through all these organs of their body and say, yeah, I have that, yeah, I have that. Right? Now go to the video that we have online for learning their subluxation story. So you create this story that's focused on their organs. You keep their focus on the organs, not on their back pain. Then at the end of the consult, you give an overall review. Miss Jones, you came in with back pain, but looks like your whole spine is weak. You have 15 different organ problems, right? Your whole spine is weak, causing organ problems in every area of your spine. Since that car accident, you weakened your whole body, your immune system's crashing. Metabolism, you don't even feel like you have the energy to be a good mother. 2 default questions, coaching questions. Are you ready? How do you feel about that? Right? Or what's that mean to you? What's it mean that you're so tired you don't feel like a good mom? Oh my God, that's the worst thing in my life. Right? Is that the most important thing to you? Yeah, so what's that mean that you're not fulfilling that? Well, I feel like a failure. Okay, that's why they're gonna buy. Now you remember that. What's that mean? How does that make you feel? Let's go to physiology. Now we have focus on the organs, we have meaning. I feel like failure. How's that make you feel? It's depressing. Do you feel that in your body right now? Yeah, see what they feel in their body wires in their mind. That's what they remember. That's the impression. Now you go to the exam, they gotta feel injured, so you're gonna shift them in their postural distortions. Someone's got a translation, you dig on the side of compression. They got a lateral flexion, dig on the side of compression until they squirm so they feel injured. Not pain. Pain doesn't motivate people. Injury is why people go see a doctor. So you dig on their, like this, and you touch them. You show them where the nerve distribution is. You touch them from head to toe. How you touch them in the exam and create the kinesthetic experience shifts their physiology. That actually can shift the meaning. So once you shift them, you bend them, you take control of their body, you stroke the nerve distribution, you're digging on the pain area. Man, you've touched them from head to toe 3 times. We spend 4 hours, how many hours? 4, showing you how to touch from head to toe in 6 minutes. That's the most thorough exam. They'll feel completely injured. They'll know they have a full spine problem, and they'll know it's related to their organs. Okay, that's day 1. Take an x-ray, then they come back on day 2. See, when you show them the x-ray and you're describing the principle, hey, you lose a curve in your neck, whatever that is, there's tension on the cord, energy is not getting in your body. Right? Now you're touching them. Hey, here's a normal spine. Energy is flowing through there. Here's yours. You move it much slower, right? This is why you're feeling like this. This is why you feel like a bad mom. Remember, you feel like a failure. You bring that back. Remember how depressing that was for you, right? Looking at this. Hey, here's what's causing this. Mr. Jones, the husband's at the ROF. How do you feel when you hear that your wife is depressed about how she's fulfilling the role as a mother? I'm sure you know that you may already have an idea about that. How do you feel? What's that mean to you when you hear your wife say that? Now you bring in the spouse, you get them as your advocate. What are they gonna say? Man, I don't like that at all. Honey, why don't you tell me about that, right? They go into their emotional conversation. This is how you engage them both. 2 default coaching questions. So after you go through the x-rays, how do you feel when you see that? What does that mean to you that your posture and spine are so weak it's bringing your health down and your health is breaking down every day? What's that mean to you? What's the most important thing in your life? So if this is breaking down the most important value, the core value you have in your life, how do you feel? See, that brings it into their physiology. That shifts their focus. Now when you do that on day 1, day 2, it's easy to get a new patient to the workshop with a spouse. It's easier to get a commitment. Now on future tips, we're going to take physiology and facts, and we're going to show you how to take that through a financial and a commitment to care. So what are the 4 main steps? Hey, get them from pain into posture. Let's get the 20% facts so we can at least be on the same area. Now, let's assign meaning to those organ problems in physiology. Now let's dig on them till they're injured so they feel it in their body through a kinesthetic experience. Then at the ROF, when we go through their x-rays, how do you feel about that? What's that mean to you? What's the most important value in your life? How does it feel that you're losing that aspect of your life? That will change your life. You're a chiropractor because you have a vision to help and serve more people, and we don't want any variables in their life. Subluxated spine and posture is a life and death decision. Let's help create that meaning more often. Help them feel it, and your patient commitment in getting lifetime care will jump significantly in your practice. Thanks. Watch out for the next tips.